I think people want to know about medications. And I feel like, Dr. Gold, you could help us with this a little bit. Like, my sense is that there's the stigma is down on seeking out mental health, if there's access. That's the key. But there, as you mentioned, there's always a debate on like how early to start medication, especially for teens, adolescents. Has the pendulum moved at all, both with respect to what the public, the average person coming in is seeking, and also with respect to what the field is saying is sort of best standard of care?
It's complicated, I think.
It
Yeah,
really
like I
is.
think it went one way and then it went the other way, and then we're always backtracking because they think we overprescribe. So I think as a field, we're seen as a group of people who wants to just drug you. I don't practice that way. I know Amanda doesn't. I know a lot of people in our generation don't. And so our generation tends to really evaluate and will send you to therapy, believe in therapy. If therapy doesn't work, we'll add on meds. But I think it is really hard to know sometimes. The evidence on medication is that we've seen it work. It does work, but it's imperfect and it takes a really long time to work, and it works best with therapy. So it's very complicated to say like one or the other or when you need what. And I do think that if you put it like head to head with therapy, people are much more comfortable. I mean, I'm much more comfortable talking about having gone to a therapist than the fact that I take Wellbutrin and have since college, right? Like we as a society are not as comfortable with medication because it means some degree of severity that feels really hard for people. But not everyone needs meds their whole life. If they have meds for a moment in time, we have to be better about taking people off of them or trialing to take them off of them, not for things like bipolar. Sorry, guys that want to be manic, because I get it. It's fun. But, you know, I think ultimately we just have to kind of have more nuance in it and how we evaluate it and have really good patient-centered, family-centered conversations around it. Because I have a lot of patients who say, I've had these side effects on this medication for forever. My doctors just kept telling me I need the medicine and I have no choice. Like, that's not how we can approach this. Like, if they're not feeling well on them and they're either going to stop them or they feel ill, we have to find another answer. And maybe the answer is imperfect, but you have to meet them somewhere. And I think that's an important part of being a psychiatrist, an important part of having the power to prescribe medication, particularly in kids, which Amanda probably knows a lot more than me because I haven't prescribed to kids since residency.
Yeah. No, kids. So I work with very young kids, and I saw someone in the comments saying the youngest they've seen is 5. I think the youngest I prescribed has been 4 at this point. I think, you know, I do have very young kids that are on medicines and do really well on medicines. And I have a lot of parents who are very grateful for the medicines. I'd say one big sort of bucket where medicines can be very instantly helpful in some instances is ADHD. And so, you know, there's been this pendulum swinging again about, overdiagnosis of ADHD. It's like, okay, if you're a child psychiatrist and you've seen severe ADHD, it is not just your typical, and any parent or caretaker or someone who knows someone with severe ADHD, you cannot ignore it. I mean, it's to the point where the child will not sit down. They're potentially hurting themselves. They're jumping from one thing to another. Parents are exhausted. They can't sleep, all of this. And, you know, we can prescribe medications and get the child to sleep, you know, within the day. And I've had that happen recently, and parents are like, oh my gosh, I need this medication. So it depends. It just depends on what's going on. Very honest. And I let them know, I don't have an agenda. My agenda is to make you feel better. Like, I would love for you to if you want to get better on just therapy, that's great. Let's try it. But, you know, if I do really think that medicines will be helpful, and that's usually in my more severe cases, I will, you know, say, you know, in my clinical judgment, I would recommend medicines. I would try them. But yeah, checking in is really important.
Now that you mentioned ADHD, I just want to tell the government those medicines need to come back because we haven't had them, and we never had a shortage this long in anything I've ever prescribed, and it is horrible for people.
It's bad.